My name is Win Stephenson, and I'm a transplant survivor. My story is this: you've got to kind of set your watches back to 1985, and I was on top of my game. Life was really good, and then I went in for my yearly physical, and normal thing to do. And then later on that day, I got the call, and my doctor called up and said, "You got some really strange numbers on your blood test here. It looks like your liver numbers are really off the scale, and we need to come in and rerun those numbers again." So I went in, and sure enough, ran them again, showed up I had hepatitis. About 3 months later, I got really sick and went into the hospital. And at that point in time, there was only two versions of liver disease. It's hepatitis A and hepatitis B. I had neither. So they had this fancy term they use in the medical industry. It's called not A, not B. So that was my diagnosis, and that was the end of it. There was no treatment, no drugs, no nothing. It remissed on its own. Well, around 2000, the numbers started going bad again. So I went back in, and in those 15 years, they had made a lot of progress in diagnosing and treating liver disease. And they instantly analyzed, "Oh, you got autoimmune hepatitis." I said, "Well, how do I get that?" And they said, "We don't know. It might have been something, when your parents or whatever." And then around 2010, my doctors just, said, "Man, you look really rough." And I was getting to where I was feeling bad, and I did look pretty bad. And they said, we're gonna see if we can get you a transplant." And so in December, on about the 20th, maybe 19th or 20th, Monday, they said, they got a committee that said, "Okay, you need a transplant." On Tuesday, I was on the transplant list. On Wednesday, I got a call from Dr. Eason that says, "We have a liver for you. Do you want it?" So we needed to just hop right on down to the hospital, which I did. And on Thursday morning, between Wednesday and Thursday, I had a transplant. And this was like December 22nd. What a great Christmas present.